Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, you're taking the reins today.
Well, yeah,
Where are
we want to
going?
go over top three medically proven exercises to help a herniated disc and or pinched nerve, because sometimes that nerve can be pinched, that pain going on down the leg can be from that disc, or it can be from that
Further down.
piriformis muscle. So these are going to cover all three of them. So you're going to try all three of them, and you're going to do the one that gives the best results.
That sounds good, because I think a lot of times people do have, a piriformis is a muscle in your butt,
Right.
basically, and it goes over the nerve.
Right.
And sometimes people think it's coming from their herniated disc. They might even have a herniated disc, but it's actually coming from the butt.
All right, let's get to the
all right.
exercises, Bob. Bob, can you hold this?
Sure. You want me to do the exercise? Or
No,
you-
no, I've already had it in my mind. I pictured
Okay.
myself doing. I want to do the figure 4 first, which is pretty simple. You just take your right ankle, put it on your left knee. It's going to look like this from this angle, and you can do this on
So
bed.
you're making the 4 here.
Right. Yep. And if you want to stretch your hip a little bit here, you can. But the primary part of the stretch is you're going to bring this knee up, okay, and you feel that stretch right down in there. Okay, now the nice thing about this exercise, you can do it in 2 different ways. I would start here, see what the results are, and you're going to feel these results pretty quick. It should feel good while you're doing it.
Yeah, if it makes it worse or it spreads the pain out,
Yep, it's done.
It's done.
Check it off,
Yep.
It's not for you. You can also do it in a seated position. Make sure you have good posture here, and you push here. This is going to vary. I would start there. You can try it this way and see how it results, okay? Again, you should feel the symptom relief while you're doing it and very quickly, and it should feel good after you're done. You get up, you walk around, you should have positive results, feeling better. If not, check it off.
Just as verification here, Brad, so if the pain's going down the right leg, that's the one you cross over?
Right.
So you want to lay down one real quick?
Sure.
So if it's right leg, you're going to go like that.
Right.
If it's left leg, you're going to go like that.
Good point,
and then you're going
Bob.
to pull up. Then you're pulling up like
Yes.
that. Yep. Okay.
Yep, excellent point, Bob.
All right.
This is why he's along, because otherwise we
Once
miss
in a while I come in
major
handy.
points like this. The next one is just on your stomach. Now, you can't do this one on the bed. You really should do it on a carpeted floor, so it's comfortable. Hands here, and a simple press up like this.
Now what he's doing here is
down.
he's keeping his pelvis down.
Right.
He's not lifting this up like a board, right? He's trying to make an arch in the back here. That's really key. And again, if it starts to hurt when you go way up, just go into the pain-free zone.
Yep.
Stay down in the lower end here.
Now, on this one, if you happen to be having pain down your leg, by the first one, it might be uncomfortable. You do a few more, and if it starts to improve with each repetition, you keep going. 10 is usually the max you do at one time. You can maybe go up to 15 if you're getting really positive results of feeling really good.
And by positive, what he means is that quite often, if the pain's going all the way down the leg, it might start coming up the leg a little bit. It won't go as far.
Right.
With all these issues, the further the pain spreads out, the worse it's getting.
Right.
If your pain is right up in here in the back, if you can get it back up into the back and staying there, even if it's a little worse, that's better than leg pain going down or
Right.
numbness or tingling going down.
If you're starting this and you have no symptoms or pain down your leg, then you're going to look at the back pain, and the back pain should feel better or feel like it's going into
Shrinking
a
up,
smaller
yep.
spot. Okay, and number 3 and final one. Can I see that?
Yep,
Bob's
tennis
not
ball.
hanging on to this just for the fun of it. He's put to useful work managing the tennis ball so we didn't lose it. This one, you're going to lay down, legs flat. Again, the figure 4, but in a flat position,
Sure.
here, just like that. And begin, right leg is going to be the one with the symptoms of
Okay.
pain. And you can do a little hip stretch here and see how that goes. But the primary part is you get a tennis ball, and you're going to put it. Now, where you put it, you're going to have to figure out. I mean, I know where the piriformis muscle is, and I can get to it pretty quickly. But if you're not familiar with the anatomy that well, you're going to have to find. Usually, on this, it's going to hurt a little bit.
Right, a little bit of a tender spot.
Right, but you're just going to leave it on there for about after 30 seconds or so. The pain should decrease notably, and you say, "Oh, it feels quite a bit better." And then, if that symptoms down the leg go along with it, and they go away, your goal. You want
This
to
is
keep
actually an
working it.
interesting technique, Brett. I never seen this one before. I actually will have to try this with some of my patients. but
Sure,
yeah,
yeah.
it's I can see how it would work.
Yeah, and you
So-
can move that tennis ball from site to site. You may try 4 or 5 different locations and just monitoring. Again, 30 seconds or so, roughly, and you should start to feel positive results. And when you get done and you get up and walk around again, if you're at pain at a 5 or down to your knee or your ankle, if it's up to your buttock area and it's abolished that leg pain, you know your goal. It's continue to
Right.
do that at least 3 times a day.
At least you could do it even more.
Yep.
I mean, and again, we emphasize again, this should make things better. If it makes
Right.
things worse, you stop immediately.
yep,
This
you
is
just
not
scratch it off and-
So, and remember, Brad, we can fix just about anything.
Exactly. What can't we fix?
A broken heart.
Oh, that's right, the broken heart. Oh, we don't have
we
it
don't
here.
have a heart.
Yeah,
He doesn't
well,
even have a heart anymore.
yeah, well, we're working on that because I'm
So-
going to do some self-study and then I'm going to read some books and then talk to my wife about it a little bit and we'll get it figured
You
out.
probably have his heart in your lab, don't you?
Yeah.
In your
oh, yeah.
workshop. All right. Thanks for watching.